Now, let's talk about the prevalence, development, and risk factors of generalized anxiety disorder. So, when it comes to the prevalence, generalized anxiety disorder is a common disorder globally, but rates vary by geography and income. And in the 12-month prevalence rate is 2.9% among adults and 0.9% among adolescents in the United States. The mean 12-month prevalence rate worldwide is 1.3%, with the lifetime morbid risk in the United States being 9%. So this means nearly 10% in the United States are at risk of generalized anxiety disorder and might have experienced it at some point. So it's fairly common. Individuals from high-income countries are more likely to report symptoms meeting generalized anxiety disorder criteria in their lifetime than individuals from low and middle-income countries. So it does seem to disproportionately impact those from high-income countries. Now let's talk about the development and the course of generalized anxiety disorder. So, the mean onset of generalized anxiety disorder in North America is 35 years old, which is later than the onset of other anxiety disorders, and the disorder rarely occurs before adolescence. So, something that a key difference between generalized anxiety disorder and social anxiety disorder, for example, is that with social anxiety disorder, the median onset is age 13. Whereas with generalized anxiety disorder, it tends to occur much later, well past adolescence and into adulthood. Now, let's talk about the course. So, generalized anxiety disorder symptoms tend to be chronic and fluctuate. So, they wax and wane across the lifespan, and they move between syndromal and subsyndromal forms. Rates of full remission, however, are very low. So full remission is pretty low, but the intensity of generalized anxiety disorder tends to ebb and flow. Now, in terms of severity, symptoms that meet generalized anxiety disorder criteria earlier in life are associated with more comorbidity and impairment. Younger adults tend to experience greater severity of symptoms compared to older adults. So, for those who have an earlier onset, impairment in general is much higher, and it tends to associate with comorbidity, whether that be physical conditions or other mental health conditions. Now, speaking on risk and prognostic factors, so what are some of the temperamental factors that are associated with or contribute to generalized anxiety disorder? And one of the most prominent associated factors is negative affectivity, which is also known as neuroticism. Another one is behavioral inhibition, harm avoidance, reward dependence, and attentional bias to threat. So these people with generalized anxiety disorder may sort of scan their environment and their life for threats. They may be dependent upon rewards, and they may seek to avoid feeling negative emotions or avoid, important risks to their safety. And in terms of environmental factors, so childhood adversities and certain parenting practices can dispose one to developing generalized anxiety disorder down the road, and specifically overprotecting children, over controlling them, and reinforcing avoidance are linked to generalized anxiety disorder. And now, what about genetic and physiological risks? So, approximately 1/3 of the risk for experiencing generalized anxiety disorder is genetic. So, there is a strong genetic component to this, and these genetic factors overlap and are shared with the risk of major depressive disorder and negative affectivity or neuroticism. So, in general, the genes that contribute to neurotic personalities and major depressive disorder are also implicated in generalized anxiety disorder. And now, what about sex and gender related differences? So, let's talk about prevalence first. Women and adolescent girls are at least twice as likely as men and adolescent boys to experience generalized anxiety disorder. In epidemiological studies, approximately two-thirds of cases are women, where the female to male ratio is similar to 1.74 to 1 found in some studies, while in clinical settings, women make up about 55 to 60% of presentations. So in clinical settings, they're slightly underrepresented when it comes to um, the epidemiological studies when compared to those. So now comorbidity. Although men and women experience similar symptoms, they demonstrate different comorbidity patterns. In women, comorbidity is largely restricted to other anxiety disorders like unipolar depression. In men, comorbidity is more likely to extend to substance use disorders. And this is also true of social anxiety disorder, where men with social anxiety disorder tend to abuse substances more often than women. So when you see unipolar depression or other anxiety disorders, this might raise flags in women that they might have generalized anxiety disorder as well. And for men who use substances in a maladaptive way, that could also indicate that generalized anxiety disorder might also be a comorbid risk. And now let's talk about suicidal thoughts and behavior. So generalized anxiety disorder is associated with increased suicidal thoughts and behavior, even when accounting for the presence of comorbid disorders and stressful life events. So that is to say, generalized anxiety disorder, independent of other stressful events, increases suicidal thoughts and behavior, or at least there's an association. It doesn't necessarily cause those, but it is associated with suicidality. Psychological autopsy studies indicate that generalized anxiety disorder is the most frequent anxiety disorder diagnosed in suicides. So that is something to keep in mind, that when you are working with a population or clients, patients with generalized anxiety disorder, suicidality is quite prominent and it's something to keep in mind. So assessing for suicide frequently will probably be necessary when working with clients or patients with generalized anxiety disorder.